Hello everyone, welcome to Lumps Lecture Series featuring Basic TCM and Tongue Diagnosis Made Easy, Day 5 of 12. Today we shall talk about the lungs and the large intestine. Functions of the lungs: govern qi and respiration, govern diffusion and downbearing, open at the nose, control the body surface, house the corporeal soul or po, and emotion of the lungs is sorrow. The lungs govern qi. This means that the lungs are responsible for breathing and production of true qi. Spleen produces food qi or ku qi from the food that we ingest. The spleen sends food qi to the lungs. In the lungs, the gathering qi and true qi are produced using oxygen of the air, which can be viewed as cosmic energy. Pure energy is assimilated while breathing in. Impure energy is expelled while breathing out. True qi is divided into nutritive or yin qi and defensive or wei qi. Production of gathering qi and true qi in the lungs is influenced by original yuan qi of the kidneys. The lungs, kidneys, and spleen are involved in weakness of gathering qi and true qi. Lungs nourish the skin and body hair and protect exterior against invading pathogens. The diffusion aspect, which is one of the aspects of lungs' function to govern the qi, is responsible for ensuring movement of qi and sending wei qi outward to body surface. On the body surface, wei qi protects us from invasion of pathogenic factors. Dryness, according to the 5 elements theory, is the main pathogen affecting the lungs. If wei qi is weak, the lungs can be attacked by all pathogenic factors, since lungs are the most exterior organ and breathing function connects the lungs to the outside world. The strength of the immune system and ability to prevent invasion of pathogenic factors is based on harmonious function of all organs involved in qi production. The kidneys are the source of a strong immune system, nourished by food qi of the spleen and stomach, distributed through the lungs. The lungs govern waterways, which is combination of the 2 functions of diffusion and downbearing. Diffusion means the fluids are distributed throughout the body and to the skin, where they leave the body in the form of sweat. Downbearing means wastewater is conveyed to the kidneys and bladder to be discharged. The lungs send qi and body fluids to the kidneys. The kidneys in turn must be able to hold the qi and body fluids. If the lungs are not able to maintain this function, stagnation develops in the lungs, causing weakness in the kidneys. If the downbearing function is impaired, then edema, mostly in the upper body, can develop. The nose is the outer orifice of the lungs. If lung qi is in harmony, nose is clear, breathing is smooth, the sense of smell works normally. When the lungs are affected by internal or external factors, for example, wind, damp, this will lead to common cold or rhinitis and chronic congested nose. The lungs nourish the skin and body hair, protect the exterior against invading pathogens. Lungs send and distribute wei qi outward to the body surface. The lungs nourish the skin and body hair by distributing nutritive yin qi to the body surface. If the function of distributing body fluids is impaired, this will lead to edema, mostly in the upper body, for example, face edema in the morning. The lungs are responsible for opening and closing of the pores and sweating. Lungs nourish and moisten the skin. Malfunctioning of the lungs can lead to dry skin. Application of cream doesn't solve the problem because the cause is internal. Impairment of this lung function can be a result of spleen weakness. The spleen, when weak, produces too much dampness, which can accumulate under the skin. Pores are no longer permeable. The skin is dry on the outside but moist internally. Corporeal soul is responsible for our instincts. The function of corporeal soul is to enable the body to move and perform its functions. The ability of a newborn baby to breathe, cry, and take milk is understood as manifestation of corporeal soul. Corporeal soul gives us ability to perceive instinctively. People with strong corporeal soul have the ability to intuitively sense danger. Intuition not to board airplane on a particular day originates from corporeal soul that warns us of coming danger. The corporeal soul represents our future. Fear of the future or existential fears has its root in impairment of corporeal soul. Powerful or long-lasting emotions can damage the qi. Sorrow is emotion that causes qi to disperse, and sorrow affects lung qi. It is a healthy process to experience sorrow. For example, when we lose a loved one. Separation causes sorrow, and it is necessary to experience it in order to let go. If we are not able to grieve, or if we have no time to grieve, this emotion affects the lungs and disperses lung qi. This can manifest in hoarse voice, faint voice, or breathing difficulties. If the practitioner treats a patient with repressed sorrow and lung qi is moved and tonified, the patient may respond with crying. This is a very important and healthy reaction which is needed in order to dissolve suppressed sorrow. Lungs are responsible for contact with our environment. If lung function is harmonious, we are able to have close relationships and we are able to protect ourselves if needed. It is particularly important for a practitioner to protect himself in a healthy manner from his patient's problems. Lung relationships. Lungs and heart. Heart governs blood, lungs govern the qi. Blood of the heart nourishes the lungs. Lung qi warms the heart and supports it in production and circulation of the blood. Relationship between heart and lungs corresponds to the relationship between qi and blood. Disturbance of the heart can result in disturbance of the lungs and vice versa. The lungs govern qi. The liver is responsible for harmonious flow of qi. If liver qi stagnates, it affects the down-bearing function of lung qi. Lung qi can accumulate in the thorax and cause stagnation. Liver requires lung qi to regulate the blood. The lungs stand in interior-exterior relationship with the large intestine. The down-bearing function of the lungs is needed by the large intestine in order to convey and transform waste. Disorders of the large intestine can be caused by lung deficiency. Functionally, The large intestine has a closer relation to the digestive tract and its organs, spleen, stomach, the small intestine. The spleen transforms ingested food into food chi. Then food chi is sent to the lungs. Gathering chi is produced in the lungs by transforming food chi and the inhaled air. True chi is produced in the lungs by transformation of gathering chi and under the influence of original yuan chi. Quality of true chi depends on food chi and spleen function. If spleen function is impaired, dampness is produced. Dampness is sent to the lungs where it accumulates. Spleen is producer of dampness, lungs the storage for dampness. Spleen depends on lung chi to fulfill its functions of transformation and transportation. Lungs govern the chi and kidneys are the root of chi. Lungs regulate waterways and aid the kidneys to govern water. Kidneys ensure absorption of chi through the lungs. If kidney yang is deficient, the ability to absorb chi is impaired and chi stagnates in the lungs. If lungs are too weak to fulfill the function of downbearing the chi, kidneys are affected. Kidney yang supports the lungs in chi production. Pathology. Deficiency patterns, lung qi deficiency and lung yin deficiency. Excess patterns, stagnation of lung qi, wind heat in the lungs, wind cold in the lungs, dryness in the lungs, phlegm cold in the lungs, phlegm heat in the lungs. Lung qi deficiency. To treat lung qi deficiency, all organs involved in qi production have to be treated simultaneously. Cardinal symptoms: susceptibility to common cold, spontaneous sweating, low voice, forceless cough, shortness of breath on exertion, watery sputum, aversion to cold. Forceless cough, because lung qi is too weak to control respiration and to downbear the qi, so that qi rises uncontrolled. Copious watery sputum results because lung qi is too weak to distribute body fluids so that they transform into sputum. Laziness to speak or reluctance to speak. The lung qi is too weak to control vocal cords. Low voice, because lung qi is too weak to stimulate vocal cords adequately. Aversion to cold means defensive qi is sufficient and is not able to warm the skin and muscles. Susceptibility to common cold, the defense way qi is too weak to protect the body against external pathogens. Shortness of breath on exertion, lung qi is too weak to control respiration and to downbear the qi, so that it rises uncontrolled. Fatigue, lungs do not produce enough qi. Pale facial complexion, qi is deficient and the transportation of qi and blood to the face is impaired. Spontaneous sweating, opening and closing of the pores is governed by lung qi. If wei qi is deficient, pores cannot be controlled and spontaneous sweating occurs. Lung yin deficiency. Lung yin deficiency impairs moistening function. Signs of dryness manifest. Lung yin deficiency is the result and further complication of dryness in the lungs. Cardinal symptoms: dry cough, dry skin, dry throat, itching in the throat, night sweating, 5-center heat, hoarse voice. Dry cough or cough with scant sticky sputum. lungs are not moistened sufficiently. Hoarse voice, lungs don't moisten the throat sufficiently. Dry throat, lungs don't moisten the throat sufficiently. Dry mouth, throat, and nose, the lungs' moistening function is impaired. Dry skin is due to impairment of lungs' moistening function. Bloody sputum, blood vessels are damaged by heat in the lungs. Night sweat. At night, Wei qi that circulates in the body surface during the day moves back in the yin organs. In yin deficiency, heat inside the body is increased. At night, this heat is even strengthened by Wei qi inside the body so that the body fluids are driven out of the body in the form of sweat. Stagnation of lung qi. Stagnation of lung qi impairs downbearing of qi, and qi accumulates in the thorax. Cardinal symptoms: repressed sorrow, feeling of constriction in the thorax, existential fears, shortness of breath. Dryness in the lungs. Dryness in the lungs is considered to be the initial stage of lung yin deficiency. Cardinal symptoms: dry cough, dry throat, itching in the throat. Dry cough because the lungs are not moistened sufficiently. Hoarse voice, the lungs do not moisten the throat sufficiently. Dry throat, the lungs don't moisten the throat sufficiently. Dry mouth, throat, and nose, lungs moistening function is impaired. Dry skin, lungs moistening function is impaired. Wind cold in the lungs. In wind cold in the lungs, the defensive qi of the lungs is fighting against invasion of wind and cold pathogenic factors. Cardinal symptoms: acute cough with watery or white sputum, aversion to wind and cold, sneezing, feeling chilly, shivering. Wind heat in the lungs. Wei qi of the lungs is fighting against invasion of wind and heat pathogenic factors. Can be a reaction to wind cold in the lungs. Cardinal symptoms: acute cough with yellow sputum, aversion to wind and heat, infection with fever, sore throat. Phlegm cold in the lungs. Dampness or phlegm and cold have invaded the lungs. Phlegm cold in the lungs corresponds to excess pattern involving the spleen. Spleen is always involved in the development of dampness. Cardinal symptoms: cough with white viscous sputum, feeling of constriction in the thorax, aversion to cold, face edema with cold sensation, white tongue coating, sinusitis with white secretion. Phlegm heat in the lungs. Dampness and heat have invaded the lungs and are condensed into phlegm. Phlegm heat in the lungs corresponds to an excess pattern involving the spleen. Spleen is always involved in the development of dampness. Cardinal symptoms: cough with yellow viscous sputum, feeling of constriction in the thorax, aversion to heat, face edema with heat sensation, yellow tongue coating, sinusitis with yellow secretion. Let's talk about the large intestine. Functions of the large intestine: governs transformation and discharge of waste. The receiving of waste passed down by the small intestine, absorbing usable fluids that are passed on to the spleen and kidney, then forming waste products into the stool before discharging it from the body. The large intestine is supported by down-bearing function of lung qi. It conveys our mental waste. Disorders of the large intestine are most of the time consequence of disorder of the spleen. Disorders of the large intestine should be viewed in context with all other organs involved in the digestion process. Impairment of the lungs' down-bearing function can affect the large intestine. Relationships. The small intestine passes the waste down to the large intestine. The lungs stand in an interior-exterior relationship with large intestine. The down-bearing function of the lungs is needed by the large intestine in order to convey and transform waste. Disorders of large intestine can be caused by lung deficiency. Functionally, the large intestine has a closer relation to digestive tract and its organs, spleen, stomach, small intestine. Functionally has a close relation to the spleen. It depends on the spleen's function of food transformation. If this function of spleen is impaired, disorders of large intestine can manifest. Pathology. Excess patterns, cold in the large intestine, dryness in the large intestine, heat in the large intestine, damp cold in the large intestine, and damp heat in the large intestine. Cold in the large intestine appears in combination with spleen-yang deficiency. Cardinal symptoms include acute diarrhea with shivering, aversion to cold, dull abdominal pain, rumbling intestines, odorless stool. Heat in the large intestine. Because the large intestine has close relationship with the spleen, disorders of large intestine are often a consequence of spleen and stomach disorders. Heat in the large intestine will show manifestation of spleen and stomach disorders as a result of stomach fire. It can also affect the large intestine and cause heat. Cardinal symptoms: constipation, strong smelling stools, burning sensation in the anus, and fever. Dryness in the large intestine. Because the large intestine has close relationship with the spleen, disorders of the large intestine are often consequence of spleen and stomach disorders. Dryness in the large intestine is a manifestation of spleen and stomach disorders. Dryness in the lungs can affect large intestine and cause dryness. Cardinal symptoms: constipation with dry stool and thin body. Damp cold in the large intestine. Damp cold in the large intestine appears in combination with damp cold in the spleen. Cardinal symptoms: soft, odorless stool, mycosis, aversion to cold, dull abdominal pain, feeling of heaviness. Damp heat in the large intestine. Appears in combination with damp heat in the spleen. Cardinal symptoms: strong smelling stool, mucus and blood in the stool, ulcerative colitis, Crohn's disease, mycosis, burning sensation in the anus. Thank you very much for your attention.